Hello, and welcome to the doctor's office. Today, we're going to be speaking about the thyroid gland. My name is Dr. Michael Badanek. I practice in Ocala, Florida. I've been in active private practice as a licensed healthcare provider from 1981 to the present. That's roughly 36 and a half years. I deal with functional integrative medicine, and this type of medicine deals at a much higher level in the investigative and also the treatment protocols for disease states. Today we'll be speaking about the thyroid gland. The thyroid gland is located in the neck. It's comprised of two halves, two lobes, and on this thyroid gland are four small glands called parathyroid glands, which deal with the secretion and the regulation of calcium in the body, particularly calcitonin. The thyroid gland is probably one of the most misdiagnosed and mistreated organs in the body. This gland is the largest of all the glands producing hormones, particularly a product called thyroxine or T4. There are many different conditions that affect people from the thyroid gland, but let's first talk about some of the symptoms. Most of the symptoms that are produced from the thyroid gland are things such as a loss of hair, particularly when you shower or brush your hair. The hair will come out in the brush or on the towel. You'll notice the outer thirds of your eyebrows being diminished in size and or hair itself. Constipation is a big major player with many people with thyroid conditions. Irritability, insomnia. Band-like headaches across the eyes when you first get up in the morning is a classic symptom of hypothyroid disease. You can also have dry skin. You can also have mental focusing, unclear situations occurring. And these are just one or two or many of the major conditions that are affected with thyroid disease. Let's now first talk about some of the thyroid conditions. There are 5 different thyroid conditions that affect the human being. First of all, you have the overactive thyroid or hyperthyroid condition known as Graves' disease. You have a condition called secondary hypothyroidism. That terminology is euthyroid disease. It is a secondary hypothyroid condition primarily due to issues of the adrenal glands, the hypothalamus, and pituitary gland. You have then frank thyroid disease, hypothyroid disease. You have another condition called autoimmune thyroid disease or Hashimoto's thyroiditis. And finally, you have either benign or malignant tumors of the thyroid gland. I find in my office during my tenure in treating patients that the thyroid gland is usually misdiagnosed and mistreated. In traditional allopathic or osteopathic medicine, some of the tests that are utilized are very small in numbers. Classically, if you want to do a proper thyroid profile, you need to do about 9 to 10 specific thyroid tests or studies. Classically, the gold standard in the evaluation of a thyroid gland dysfunction is the TSH, or thyroid stimulating hormone. This hormone is produced in the anterior pituitary gland, which sits right between your eyes. It then this hormone goes to the thyroid itself and helps to stimulate the production of thyroxine, which is T4. However, in order to have a proper production of T4, you have to have ample amounts of iodine, particularly a form of iodine called potassium iodide, and also an amino acid called tyrosine. Another test is the T4 total. That is the amount of thyroid hormone produced by the thyroid gland. Then there is a test called a T4 free. Remember, your free forms of your hormones, be it the sex hormones and or thyroid hormones, are the most active forms. Then there is a T3 total. This is a conversion of T4 to T3, which is triiodoiodine. This particular process occurs in the liver, the gut, the lung, and the kidney. And then the T3 total has another test called the T3 free. The T3 free is the most active of all thyroid hormones and is the major player for all functions of the thyroid gland, dealing with thyroid hormone regulation. If, for instance, you're on hormone replacement therapy or are taking hormones for erectile dysfunction or other maladies in the body, a test called the T3 uptake is needed. This T3 uptake will also be elevated when we have elevated levels of thyroid hormone being suppressed by other outside hormones, usually sex hormones. Then there's a test called a reverse T3 that determines whether or not there is an ample conversion of T3 total to T3 free. And if that is an elevated number, that's usually due to an adrenal gland problem. And so then you would stress the advent of checking the adrenal glands to see if there's adrenal function or dysfunction. There's two other tests called the thyroid peroxide antibody and the thyroglobulin antibody tests. These two particular tests are indicative of Hashimoto's thyroiditis, an autoimmune disease which attacks the thyroid gland. Classically, the thyroglobulin antibodies is elevated in the first 1 to 3 to 4 years of Hashimoto's disease. Then in years 3 to years 6 or 7, you'll have an elevation of the thyroid globulin and thyroid peroxide or peroxidase antibodies. That means you're in mid-stage. And finally, in end stage, let's say you've had Hashimoto's disease greater than 7 years, you'll usually have just a thyroid peroxide antibody elevation only. As you can see, there are many, many tests, and these particular tests have direct correlation with proper thyroid function. In traditional medicine, there are usually 3 different major synthetic hormones utilized for thyroid care. Number 1 is either synthroid or Levoxyl for hypothyroid disease, hyperthyroid disease, or autoimmune disease, and that's primarily a synthetic T4. Occasionally, if the T3 or the triiodoiodine is extremely low, they will give a product called Cytomel. Again, these products deal with primarily treating symptoms and not the cause of disease. We deal with functional integrative medicine here at this office, and we want to find the cause, such as heavy metal toxicity, abnormal dental issues in the mouth resulting in that, deficiencies of minerals, deficiencies of amino acids, and all of these particular factors have a direct bearing on the thyroid gland. This is just a simple touch of the complex issues that occur with a person suffering with thyroid conditions. For further information, we urge you to call our office at 352-622-1151. That's 352-622-1151. Or go to our website at drbadanek.com. That's DRBADANEK.com. We'll be more than happy to set you up an appointment for a courtesy consultation, and we look forward to helping you with your health challenges. Have a nice day.